Welcome back to ZeroDiabetes Zone. Today, we're diving into an important topic that often goes unnoticed, the connection between diabetes and liver health. If you have diabetes or know someone who does, this is vital information you won't want to miss. Let's get started. Understanding the liver's role. The liver is a powerhouse in our bodies. It processes everything we eat and drink, stores energy, and detoxifies harmful substances. But did you know that it also plays a crucial role in blood sugar regulation? The liver stores glucose and releases it into the bloodstream when needed. For people with diabetes, maintaining liver health is essential because the liver's ability to manage glucose can directly affect blood sugar levels. Diabetes and non-alcoholic fatty liver disease, one of the most common liver conditions associated with diabetes, is non-alcoholic fatty liver disease, or NAFLD. NAFLD occurs when excess fat builds up in the liver, and it's especially common in people with type 2 diabetes. This condition can lead to inflammation and even liver damage if left untreated. Studies show that up to 70% of people with type 2 diabetes may develop NAFLD. Risk factors and symptoms. NAFLD often has no obvious symptoms in the early stages, making it a silent threat. However, certain risk factors increase the likelihood of developing this condition. These include obesity, high blood pressure, high cholesterol, and of course, poorly controlled diabetes. If you experience symptoms like fatigue, abdominal pain, or unexplained weight loss, it might be worth checking your liver health. Prevention and management. So, how can you protect your liver if you have diabetes? The good news is that many of the strategies you use to manage diabetes can also help keep your liver healthy. Here are some tips. Number 1. Maintain a healthy weight. Losing even a small amount of weight can reduce liver fat. Number 2. Eat a balanced diet. Focus on whole grains, lean proteins, healthy fats, and plenty of fruits and vegetables. Number 3. Exercise regularly. Aim for at least 30 minutes of moderate activity most days of the week. Number 4. Monitor blood sugar levels. Keeping your blood sugar in check can prevent excess glucose from being stored as fat in the liver. Number 5. Avoid excess alcohol. Alcohol can exacerbate liver issues, especially when combined with diabetes. Making these lifestyle changes not only helps manage diabetes, but also supports liver health. When to seek medical advice. If you're concerned about your liver health, or if you have diabetes and want to know more about NAFLD, it's essential to consult with your healthcare provider. They can perform tests such as blood work or imaging studies to assess your liver function and provide guidance tailored to your needs. Final thoughts. Your liver is a vital organ that works hard to keep your body healthy, especially when you have diabetes. If you found this video helpful, please give it a thumbs up, share it with others, and don't forget to subscribe to ZeroDiabetes Zone for more diabetes-friendly tips and insights. Thanks for watching, and see you next time. Stay healthy, stay informed, and remember your health is in your hands. Take care.